It is part of the male reproductive system, one of the most important organs in terms of reproduction. Some people may refer to it as their future generation. Most men may be ashamed to talk about this special and yet important organ, but until something goes wrong with it. Welcome folks, and today we are going to talk about testicles and particularly testicular pain. Testicular pain has been on the rise among men, and there's need to address it. You know, men, they tend to be so ignorant in terms of seeking for medical care compared to ladies. They'll come to think of it when the situation is dirty or nasty. So without going into much details, let's look at testicular anatomy. Take a walk with me to the testicles. So what are testicles? I'm sure these organs are not uncommon to everyone. The testicles form part of the male reproductive organs, with the primary function of sperm production and production of the male hormone, testosterone. These important organs are contained within a sac-like structure called the scrotum, located between the penis and the anus. Adult testicles are about the size of two large olives. Sometimes actually it's normal for one testicle to hang lower than the other within the scrotum, and it's normal for one testicle to be bigger than the other. And the right one tends to be the bigger one. Located near the back of each testicle lies the epididymis, a coiled tubular structure that functions to store sperm and transport sperm. On reaching puberty, a man will produce millions of sperms every day, each measuring about 0.002 inches, an equivalence of 0.05 millimeters long. There is a system of tiny tubules in the testicles with a special name, seminiferous tubules. They house germinal cells that are hormones. For example, the male hormone testosterone will act on and cause them to turn into sperms. The germinal cells are divide and change until they resemble tadpoles with the head and the short tail. Using fructose or fructose, depends on their pronunciation, as a source of energy, the tail pushes the sperm into a tubular structure behind the testicles that we had called earlier the epididymis. So the sperm will travel through the epididymis for about 5 months, completing its development. Once out of the epididymis, the sperm will move into the vas deferens, also called ductus deferens. When a man is stimulated for sexual activity, sperms are mixed with the seminal fluid secreted by seminal vesicles and prostate gland and form what we call a fluid called semen. As a result of stimulation, semen, which contains about 500 million sperms, is released out of the penis. A special term for this is ejaculation during copulation, coitus, and for those who don't understand, I mean sex. A tubular structure that courses from the abdomen that contains vital structures like the vas deferens, testicular artery, artery of the ductus deferens, presbyteric artery, pumpiform venous plexus, genital nerve, a branch of genitofemoral nerve, sympathetic and parasympathetic nerve fibers, lymphatic vessels. This tubular structure is called the spermatic cord, and it's attached to each testicle. So apart from it containing the vital structures, it also suspends the testicles in the scrotum. Do you know the reason why testicles hang outside the body in the scrotum instead of them being in the abdominal cavity? It's because the body's temperature is so high, and for good sperm production, the testes need cooler temperatures. That's a temperature of about 34 degrees, an equivalent of 93.2 degrees Fahrenheit. That is 2 to 4 degrees Celsius, lower than the normal body temperature. So if someone asks you, this is why testicles hang outside the body instead of them being inside the abdominal cavity. According to the Mayo Clinic, testicular pain or testicle pain is described as a pain or discomfort in or around one or both testicles, and the pain may be acute, chronic, sharp or dull, or a sensation of soreness or vague discomfort or ache. Testicular pain can originate from the testicle itself or somewhere else, for example from the epididymis, scrotum, from the abdomen, the groin, and it occurs in one or both testicles, and we call this referred pain. Testicular pain can have a number of possible causes. They are so sensitive that even a minor injury can cause testicular pain or discomfort. Trauma, many diseases, and other health conditions play a bigger role, though there may be other possible causes. But it's important for us to understand a few that may constitute a medical emergency that need immediate medical attention. To prevent impairment or loss of testicular function, the pain may be acute, as we had seen earlier, which means short term. It may be chronic, which means long term, or it may be constant or intermittent. This condition may be accompanied with a number of signs and symptoms, but mostly it will depend with the cause. So patients may present with pain in one or both testicles. They may present with tenderness in the testicles and or scrotum. There might be redness, swelling, nausea. They may present with fever and even vomiting. Other signs and symptoms may include abdominal pain, elevation of the affected testicle, urethral discharge, loss of testicular reflexes, urinary symptoms, for example, urgency, burning and frequency, and so on. But let's look at specific causes of or specific possible causes of testicular pain. Let's begin with the epididymitis. In simple terms, epididymitis is inflammation of the epididymis. If you can remember, we said it lies behind the testicle within the scrotum, and its function is to store sperms, and also sperms may mature within the epididymis. Generally, this condition is as a result of infection. It primarily affects adult men and most common at the ages of 19 and 40. However, it can also affect prepubescent or elderly men. In sexually active males, sexually transmitted diseases are the main cause, usually as a result of infection from bacteria such as chlamydia trachomatis, Neisseria gonorrhea, and in younger and elderly males, usually it's as a result of bacteria that are present in the urinary tract system, for example, E. coli bacteria. Infections in these groups is typically as the result of abnormalities in the genitourinary system. The Neisseria gonorrhea, apart from causing testicular pain, it also causes a burning sensation and urethral discharge during urination. It produces acute and chronic inflammation to the testicles and usually involves the channels that connect the testicles to the epididymis, and these channels are called efferent ductlets. Epididymitis may come gradually, and testicular pain may be mild, moderate, or severe. Usually one testicle is affected, and signs and symptoms may include nausea, vomiting, fever, urethral discharge, urinary symptoms, for example, burning, urgency, and frequency, especially in Neisseria gonorrhea infection. Testicular and scrotal tenderness typically are localized to the area of epididymitis, though this may become more general and involve the whole testicle as the infection progresses and may lead to inflammation of the testicle, which we call orchitis. It may also present with testicular and scrotal swelling and redness, without forgetting abdominal pain. Another possible cause of testicular pain is testicular trauma. Injury to the balls occur when the testicles are hit by a force. Trauma to the scrotum, trauma to the testicles may injure any of its contents. When the tough covering of the testicles is torn or shattered, blood may leak from the wound. This pool of blood will stretch the scrotum until it stands, and this may lead to infection. It also presents with some symptoms like severe pain. Also, the pain may be due to inflammation or swelling of the epididymis secondary to injury. Epididymis has a thin wall, therefore it easily becomes red and swollen. If not treated, in rare cases, this causes blood occlusion to the testicle, and this may lead to loss of the testicle. Injury should seek care from a urologist if they have penetrating trauma to the scrotum and the testicles. They have bruising or swelling of the testicles. They have trouble peeing or blood in urine. If they develop fevers after testicular injury, causes may include penetrating forces, for example, stab wounds or gunshot wounds, or maybe blunt forces, for example, a kick or a hit by a baseball to the scrotum. This can cause all or part of the testicle break, as well as loss of the whole testicle, and injury from a penetrating object such as a knife, a bullet that punches the scrotum can cause a scab to the skin, as well as damage major blood vessels. A direct blow or an injury from a direct blow can cause tearing of the testicular covering and damage or harm its blood vessels. Another possible cause of testicular pain is testicular torsion. It occurs when there is an abnormality affecting the normal attachment of the testicle within the scrotum. It is also often referred to as bell-clapper's deformity. It occurs when the testicle rotates, twisting the spermatic cord that normally brings blood to the scrotum. The reduced blood flow causes sudden and often severe pain and swelling. This anomaly can affect both testicles, and trauma is a rare cause of testicular torsion. This condition is common in males below the age of 30 years, with a peak incidence of ages between 12 and 18 years. It can also occur more frequently during neonatal period. The left testicle is the one that is more affected, and is the commonest known cause of testicular loss in adolescent males. Testicular torsion generally comes on sudden, with severe pain only felt in one testicle. It may occur with other symptoms like abdominal pain, fever, nausea and vomiting, elevation of the affected testicle within the scrotum, horizontal positioning of the affected testicle within the scrotum, testicular end or scrotal tenderness, testicular end or scrotal swelling and redness, loss of charismatic reflexes on the affected side. Normally, the testicle usually elevate with light stroking of the inner thigh. Testicular torsion is an emergency. Another possible cause of testicular pain is varicocele. According to the Mayo Clinic, varicocele or a varicocele is enlargement of veins in the scrotum. In short, varicocele is varicose veins in the scrotum. Varicoceles are known to cause low sperm production as well as decreased quality, and this can lead to infertility. They can also cause testicles not to develop normally or shrink. It occurs with some symptoms like a sharp to dull discomfort pain that increases with standing or exertion, especially for longer periods. It worsens over the course of the day and it's relieved when you lie on your back. Also, impaired infertility. They might enlarge with time and become more apparent. They tend to look like a bag of worms and cause testicular swelling, and almost always the left testicle is involved, most likely because of the position of the left testicle. What triggers varicocele is not clearly understood, but in general, when valves are damaged, in this case valves belonging to the veins within the cord, they prevent blood from flowing and they may form pools between them. This causes the veins to widen and distend, and this may cause testicular damage and even worse, infertility. Varicose veins causes local temperature in or around the testicle to be so high, and this may affect sperm production or sperm formation, sperm movement or motility, and even function. Another possible cause of testicular pain is hydrocele. This is a fluid that collects in the sheath that surrounds the testes and causes swelling in the scrotum. It is common in newborns, but usually it disappears without treatment in the first year of life. In older boys or adult men, it may occur as a result of injury within the scrotum or inflammation. I won't talk much about this because in baby boys, it usually doesn't cause pain. But I'll talk about older men because this condition occurs as a result of injury or inflammation. For example, epididymitis, which is usually painful. It can also be caused by sexually transmitted infection. A hydrocele typically isn't dangerous, and it does not complicate fertility or it does not affect fertility, but it may be associated with underlying conditions. For example, infection or tumors or inguinal hernias, which we are going to look at next. The inguinal hernia. This occurs when abdominal contents try to communicate with the external environment through the walls that normally contain them or in which they normally reside. For this case, inguinal hernia, abdominal contents try to protrude through the abdominal musculature of the groin area. And sometimes this protrusion can cause swelling in the scrotum and subsequent testicular pain. There are two types of inguinal hernia. Indirect inguinal hernia occurs laterally to the inferior epigastric artery and follows the spermatic cord. So this means that structures in the spermatic cord will be compressed and pain may radiate to the scrotum and the testicles. If blood vessels are involved, in this case arteries, let's say they are compressed, it means that the testicular structures in the scrotum won't get enough oxygen, and this may lead to, or patients may experience aching or pain. Indirect inguinal hernia occurs as a result of a birth defect in the abdominal wall. That's a congenital or present at birth, or sometimes it may occur as a result of weak abdominal muscles. Direct inguinal hernia, on the other hand, occurs medially to the inferior epigastric artery in the Hessel's bulge triangle, also known as the inguinal triangle. This type of hernia occurs mainly in infants. Signs and symptoms may include a bulge in the scrotum and the groin area that becomes more pronounced on coughing or straining. Patients may experience a dull ache or a burning sensation in the scrotum or the testicles. Another possible cause is diabetes neuropathy. This is simply nerve damage due to diabetes. If nerve fibers are damaged, they will give disturbed information to the brain. Sensory nerves can interpret information such as itch, pain, warmth, cold, pressure. So if these informations or these experiences are disrupted or impaired, it means that they may affect the normal functioning of the testicles and even subsequent loss of the whole testicle. Kidney stones, another possible cause. What kidney stones cause is what we call radiating pain. Pain may radiate to the scrotum. Radiating pain simply means pain that occurs beyond the site that is causing the problem. Other signs and symptoms that may accompany kidney stones are blood in urine, urinary symptoms such as burning, frequency and urgency, pain at the top of the penis, nausea and vomiting, sharp and cramping pain that may radiate from the back to the groin. Doctors may advise to wait until the stone passes, but if the stone doesn't pass, patients may start experiencing symptoms of infection, for example, fever and discharge. These patients should seek immediate medical attention, or they should seek medical care as soon as possible. Mumps infection, pain and swelling of the testicles, in short, inflammation, or what we call orchitis, affects 1 in 4 men that get mumps after puberty. The swelling is usually sudden and one testicle is involved. The testicle may feel warm and tender. In men that are affected, testicular swelling comes 4 to 8 days after swelling of the parotid gland. Occasionally, swelling occurs up to 6 weeks after swelling of the glands. Mumps virus damage testicular tissue as a result of parenchymal edema. Increased pressure as a result of parenchymal edema can induce necrosis of the seminiferous tubule and atrophy of the germinal epithelium. As a result, atrophy occurs in 40 to 70% of the affected testicle. Prostatitis. The prostate is a gland found in men located just beneath the bladder and surrounds the urethra. Along with adjacent seminal vesicles, they produce what constitutes much of a men's ejaculate, that's the semen. Prostate is walnut size in young adults or young men, but size increases with age. Prostatitis tend to occur for unknown reasons, but it can result from bacterial infection that spread to the prostate, either from the urinary tract or bloodstream. Bacterial infection tend to recur, that's chronic bacterial prostatitis, or develop rapidly, that's acute bacterial prostatitis. Some people may develop prostatitis in absence of bacterial infection. Occasionally, when prostatitis occurs without bacterial infection, causes inflammation but no symptoms. In all types of prostatitis with symptoms may result from spasms of muscles in the bladder and the pelvis, especially in the perineum. So patients may experience pain in the perineum, lower back, often the penis and testicles. Men may also experience urinary symptoms such as urgency, burning, and frequency. Men may also make obtaining an erection or ejaculation difficult and even more painful. Constipation can develop, making defecation very painful. With acute bacterial prostatitis, symptoms tend to be more often. For example, chills, fever, difficulty in urination, blood in urine. Bacterial prostatitis can cause formation of abscess in the prostate or the epididymis as a result of inflammation. Hematocele is another possible cause, and hematocele refers to collection of blood in a cavity or a potential space. The term usually refers to collection of blood in the tunica vaginalis that surrounds the testis. It can also be called scrotal hematoma or hemoscrotum. This condition is very rare, making it difficult to diagnose. This condition commonly occurs in men who are older than 50 years following trauma, for example, tracheal injury. It can also occur as a complication of surgery. There have been cases of this condition reported in patients with hemophilia following catheterization of femoral artery. A hematocele is one of the most common sequelae of testicular trauma. A traumatic hematocele usually results from a rupture of the testicles. That's 80% of the cases, or tear in the pampiform venous plexus. Other causes may include testicular torsion, kidney injury, pancreatitis, vasculitis, or hematological dysfunction. Signs and symptoms may include unusual lump, sudden pain, dull aching pain or heaviness in the scrotum, pain that radiates through the groin, lower back and abdomen, tender, swollen or hardened testicles or epididymis, swelling in the scrotum, redness of the skin of the scrotum, nausea and vomiting. Let's look at spermatocyst. This is an abnormal sac cyst, usually non-cancerous, filled with a milky fluid that may contain sperm. They do not cause fertility problems, no signs and symptoms, and they remain stable in size. They are usually not painful, but if they become large enough, patients may experience pain and discomfort in the affected testicle. Patients may also experience heaviness and fullness above and behind the affected testicles. Causes of spermatocyst are unknown, but might result from a blockage of one of the tubes in the epididymis that transport and store sperms from the testicles. Men whose mothers were given the drug diethylstilbestrol during pregnancy to prevent miscarriages or other pregnancy-related complications appear to have a higher risk. But this drug was halted in 1971 due to concerns about increased risk of a rare type of cancer or a rare type of vaginal cancer in women. Spermatocysts may be similar to epididymal cysts, but the only difference is that spermatocysts contain fluid with sperms. Otherwise, it's difficult to tell the difference between these two types of cysts. Other conditions such as syphilis and genital herpes can lead to sores, which can cause pain in one or both testicles. Drugs such as ciprofloxacin, which have been known to cause testicular problems, and drugs such as cocaine, which have been associated with acute scrotum. The effect of cocaine at testicular level is indirectly due to ischemic process as a result of blockage of neurotransmitter reuptake, leading to local vasoconstriction. Cocaine users are prone to repeated episodes of spermatic cord ischemia, causing vascular damage. Testicular parenchyma cannot tolerate ischemia for more than a short time. Symptoms of acute scrotum can result to irreversible acute vascular damage. Boys less than 5 years, the common cause of testicular pain is the total hydrated Morgani, also called appendix testis. Hydrated of Morgani is a remnant of a Mullerian duct and is a common testicular appendage. This structure can become clotted, presenting with a similar sudden onset pain. Often in these young males, scrotal skin is transparent enough to allow visualization of small bluish swellings at the superior poles of the testes. In young males who are suspected suspected to have testicular torsion, examination of normal, for instance, may reveal horizontal line clefts bell testis, which may raise the levels of clinical suspicion. If testicular torsion is suspected, immediate testicular exploration is mandatory, and if confirmed, bilateral testicular fixing is performed. A hydrocele is communication of fluid between the testis and the tunica vaginalis. In young men, it is associated with patent process vaginalis. On opening into hydrocele, the fluid is yellow in color. A testis which cannot be felt in a tense hydrocele in groups that are at the risk of testicular cancer should be assessed by USS preoperatively. Allow me now to talk about testicular cancer. As the name suggests, testicular cancer occurs in the testicles. Compared to other forms of cancer, testicular cancer is rare, but is the most common type of cancer in American males between the ages of 15 and 35. Any solid mass within the testicle should be considered a testicular cancer unless proven otherwise. Prompt diagnosis and early treatment are required for cure. Testicular cancer may be painless, in which case the patient may be unaware of its presence. But in patients with scrotal pain, testicular cancer should be or must be differentiated from epididymitis. The clinician should consider differential diagnosis of testicular mass, which not only include epididymitis, but the following: epididymochitis, testicular torsion, hernia, hematocele, hydrocele, spermatocele, varicocele, and syphilitic guma. Testicular cancer is highly treatable, even if it has spread beyond the testicles. You may receive one of the several treatments or a combination. Regular testicular self-exam may help identify growths early when the chance of a successful treatment of testicular cancer is highest. Physical examination is performed by palpating all the areas of the testicles. Exam should begin with a bimanual examination of all the scrotal contents, beginning with the normal testis. This permits the examiner to evaluate relative size, contour, and consistency of the normal testis. Other areas of emphasis include abdominal examination for lymphadenopathy and hepatomegaly. Examiner should also include evaluation of supraclavicular nodes, bone tenderness, and gynecomastia. Point to take home: normalize playing with the balls. By this I mean self-examination or regular self-examination. It will help you detect any unusuals within the testicles and seek early treatment. So what causes testicular cancer? Many risk factors have been associated with testicular cancer, but the exact or specific cause is not known. So what are some of the risk factors of testicular cancer? Cryptorchidism or undistended testicles. The testicles usually form in the abdominal area during fetal development, but they usually descend to the scrotum before birth. So in patients with cryptorchidism, the testicles don't descend. So these patients have a high risk of development of testicular cancer. That's an increase of 4-fold to 8-fold. The risk of developing germ cell tumor if the cryptorchid testicle is intra-abdominal is about 5%. The risk is 1% if the testicle is retained in the inguinal canal. The risk remains elevated even if the testicle is relocated to the scrotum surgically. Family history: if you had a family member or a relative who had testicular cancer, you are at a high risk of developing testicular cancer. Age: testicular cancer normally affects teens and young men, particularly those between the ages of 15 and 35. However, it can occur at any age. Race is another risk factor, and it affects white men more than black men. Infertility is another risk factor, and also abnormal testicle development. Conditions such as Klinefelter syndrome that affects the normal development of testicles can put you at a risk of testicular cancer. Prior testicular cancer is another risk factor. A previous history of testicular cancer is the strongest risk factor for germ cell tumor. Approximately about 1 to 2% of testicular cancer patients will develop secondary testicular cancer. That's a 500-fold increase compared or higher than the general population. Environmental exposure is another risk factor. Exposure to the drug diethylstilbestrol in utero is associated with cryptorchidism, and also increased risk has been suggested with Agent Orange exposure and numerous industrial occupations. Recurrent activities such as horseback riding, motorcycle or bicycle riding, local trauma, or increased temperatures have not been associated with increased risk. Lastly, genetics is another risk factor. Patients with Klinefelter syndrome are at an increased risk of developing germ cell tumor, particularly mediastinal germ cell tumor. A family member of a Klinefelter syndrome patient, they have a 6 to 10-fold increased risk of developing germ cell tumor. Also, patients with Down syndrome are at an increased risk of developing germ cell tumor. Increased risk has also been reported in the following conditions: cutaneous ichthycosis, Mullerian syndrome, androgen insensitivity or testicular feminization, mixed gonadal dysgenesis. Signs and symptoms may include a lump or enlargement of either testicles, a heavy feeling in the scrotum, a dull ache in the abdomen or groin, a sudden collection of fluid in the scrotum, a dull or aching pain in the testicles or scrotum, tenderness or enlargement of our breast, that's gynecomastia, and back pains. The different causes of testicular pain can be diagnosed using blood tests, urine analysis, and imaging studies, in addition to complete physical exam. Treatment of testicular pain varies depending on the underlying cause and may include pain medication, that's analgesics, antibiotics, and surgical intervention. But at the bottom of all, please check up with your doctor if you notice any abnormalities within your testicles. Normalize playing with your balls. It will help you detect any unusuals early and seek treatment. That is it for now. Until next time, stay happy and stay safe. Thank you.